Welcome to the Research Application Experience for the Department of Counselor Education and Supervision. This project was completed by the 2014 Counselor Education Cohort. As you can see listed, it was a full cohort project in which we all took efforts to make sure that this was a success. As counselors and counselor educators, we're very concerned with the unmet needs of mental health services in Lubbock and the surrounding communities. This has been well documented in previous studies, as well as by Census Bureau information, to show that there is a distinct need in the Lubbock area for mental health services and a need for individuals to have access to those services necessary to meet those mental health needs. Star Care, previously Lubbock Regional MHMR, completed a community needs assessment in 2001 and showed that there was a considerable need for mental health services in our community. Based on this information from the Census Bureau, Star Care, and other resources, the research application project that we decided to complete focused on these needs. Trademark outcomes for our PhD program, as you can see, is the implementation of advocacy, social justice leadership activities that impact the needs of institutions of higher education, communities, schools, and the counseling profession. This project was designed to focus on these counseling needs, as well as tying them to advocacy, social justice, and leadership in our Lubbock community. So, how do we go about addressing our application research project and identifying the needs for counseling services in the Lubbock area? We identified several individuals in the community that were professionals in the field and conducted interviews with them. We asked them a series of questions in a structured interview, and address the following list of questions. We asked them to tell me about the work that you do with clients needing clinical mental health counseling services. Describe counseling services you might believe and are lacking in the Lubbock area. Tell me about any groups who might need more services than others in the Lubbock area. And based on client needs, describe services you wish you had time to offer. Then we had a series of questions that guided our study. These were: what specific counseling services are lacking in the Lubbock area? Are there specific groups that lack these counseling services? And what expertise is lacking to address the unmet needs of mental health in the Lubbock community? In our interviews with the professionals in the community, we hope to be able to answer these questions to be able to apply our trademark outcomes from our PhD program to our research application project. We utilized a qualitative research study in which 7 doctoral students completed structured interviews with counselors in the Lubbock community to ascertain what kind of needs there were. The initial screening of this information came up with the following: there was a low access to counseling and mental health services. There was a lack of services to address severe counseling and mental health needs. There's a lack of access to substance abuse services, availability of adolescent and children's services, a lack of understanding of how to navigate the mental health system in the Lubbock area, a lack of trauma training for counselors, and a lack of time for school counselors to conduct actual counseling services. Dr. Janet Freshly Hicks graciously helped us prepare the IRB for our research application project. This was approved October 5th, 2015. Thank you, Dr. Hicks. As a cohort, how do we go about completing this study? 7 students enrolled in scholastic writing and in counselor internship class conducted the interviews. The data analysis was conducted by 13 remaining doctoral students. We came up with the following. Those counselors who agreed to participate in the study signed an informed consent. The appointments were made and lasted roughly 60 minutes. During the appointment, the student provided an overview of the study in terms of its purpose and its procedure. Using a script, the interview was conducted and taped. Following the interview, the tape was reviewed and transcribed. All transcriptions were treated as the transcription occurred in December 2015. Beginning in January 2016, the transcripts were analyzed and the themes were identified. Following identification of the themes, there were needs that obviously emerged. Ways and means to help and solve the counseling needs are being discussed and pursued. As part of our research project, we partnered with Family Counseling Services and their executive director, Brian Moffett. We have a video here to show you several of us doctoral students who got together and spoke with Mr. Moffett, explaining some of the results we found from our interviews. Please enjoy.
What you been up to?
Well, after compiling the results from the respondents with the research application project on mental health needs in Lubbock, one of the top themes that we discovered was access to services are lacking in the Lubbock area.
Access to services. So does that mean that when people are going in for services that they just don't have anywhere to go, kind of a thing, as far as access?
I think access in this sense was a loose term. So in the sense of access where there aren't any counseling services available to certain populations, and even with certain populations within agencies, the access to those services are limited.
Okay. Very good. All right.
Basically, what I have found working in the criminal justice field for 24 years, I noticed that there is a lack of access to services for people with substance abuse problems. There's very limited services, and after hours is one of the biggest problems that we do have. I know there's one agency in town, which is Family Counseling Services, probably the only agency that provide substance abuse services for clients in after hours. So that we need more services for individuals in terms of either treatment and help, availability of services, I should say.
Then one of the other things that we found that is pretty obvious in Lubbock is children and youth having difficulty having access to services, as far as if they don't have a way of funding, many of them do not have access to a psychiatrist or counseling services or doctors or anything, and if they require hospitalization, often that requires them to be sent off to surrounding cities.
Not being able to get services in their own community.
No, not at all.
Which would be much more
Abilene, Amarillo, Midland, they're often have to travel.
That's a big deal.
The one thing that I noticed was the lack of services for severe mental illness. So for clients who have psychotic features or who need inpatient, there's really kind of Sunrise Canyon, and it's really difficult to get someone placed there. And then even when they do, it may not be kind of an easy process to get them there. And kind of going back to what Logan said, the accessibility of it and the limited bed space. And so that's the one thing that I found.
And
the next several slides will provide you with what our results were and how our study worked out. We found that there's low access to community and mental health services. There's low access to substance abuse services. There's lack of access to counseling and mental health services for adolescents. Further results indicated that there was a lack of service available to persons with severe counseling and mental health issues. There's a lack of trauma training for counselors. There's individuals seeking services simply can't navigate the system, as it can be very complicated. School counselors need additional time to focus on counseling and mental health issues other than administrative issues. As the results continued, we also found that there's a lack of counselors specializing in services for eating disorders. There's a lack of counselors specializing in lesbian, gay, bisexual, and transgendered issues. There's a lack of counselors specializing in services for persons who do self-harm, such as cutting themselves. As our last slide for results, you can see that there's a lack of psychiatrists in the area to provide necessary services, a lack of patient beds for persons with substance abuse disorders. There's a lack of counseling mental health services for the homeless community. So as you can tell from these last several slides, there are many areas in which there's lacking mental health services, difficulty navigating these services, or overall just low access to services for mental health care. And this is clearly a problem in the Lubbock community that we as counselors and counselor educators would like to help alleviate. So the application research project that we completed demonstrated to us as counselors and counselor educators that there are plenty of areas in which we could focus to improve the lives of those with mental health concerns in the Lubbock area. The question is, what do we do with that information from here, and how do we get this information out to the community? Some of the ways we came up with were seeking to present at professional conferences, to post on the EPCE website, to post on Facebook and other social medias. Other ways that we found that we could get the word out and start working with the local community is to present to United Way program review volunteers, to seek ways to obtain funding for counseling services, and to present to other counselor education programs in Texas. Finally, we came up with some recommendations for future research and future works. That'd be to conduct similar studies with counselors in small communities in the West Texas area, using different mixed methodologies to study some of the data we found and see what else we would come up with or strengthen the current study, and also encourage future doctoral student cohorts to conduct the same research in the rural areas. Overall, the 2014 cohort feels as though it's important that we reach out to the Lubbock community as part of our overall duty and sense of community to be leaders, to address social justice issues, and to advocate for our clients. We hope to be able to use this information to move forward. We appreciate the opportunity to complete this as a cohort, and of course enjoyed working on it together. We hope that you enjoy our findings and see the necessity for us to reach out into the community and find ways to help those that need us the most and struggle with accessing these services in the Lubbock area. Thank you very much.